shift gears. I'll start with you, Senator Murphy, on this one. You mentioned the NIH grants. Senator Blumenthal mentioned the reform to ACA. Talk a little bit about the health sector, because when you look at economic and employment retention in this state and opportunities for growth, it is in that broad area of health care, whether it's our hospitals, our medical schools, the health insurers that have major presences here. How do we, as you look at this as an opportunity to grow jobs in that sector, attract additional capital investment? Talk about that first, if you would, Senator, and I'll go to Senator Blumenthal.
Sure. Well, I mentioned the best news, which is this massive new infusion of funding into NIH, and that's not likely a one-time infusion. That sets a new baseline for NIH funding. So you're talking about $2 billion in this budget, likely carried over into the next budget. That money is going to find its way largely into public institutions here in Connecticut. But there's good news on the private sector investment side as well, which was in the tax package. We have this, yearly crisis in which the research and development tax credit is in threat of becoming extinct. We now have permanently authorized the R&D tax credit, which, is transformational for a lot of companies, because in the R&D space, it allows you to sort of make investments in the long term, knowing that you're going to be able to take that benefit at year end on your taxes. So those are two really important planning tools for research here in Connecticut. In the healthcare sector writ large, we're at a moment of consolidation, right? And it's happening both on the provider level and it's happening on the insurer level. And of course, one begets the other. As providers get bigger, then insurers have to get bigger in kind. There certainly is a moment at which you get too big and there starts to be a harm to the consumer. But I think especially on the provider side, I think there are real benefits that come to consolidation done the right way. And I am slightly contrarian on this notion. I know there's a movement here in Connecticut in the legislature to try to put blockades in the way of not-for-profit consolidation. I think if you do it the right way, you get economies of scale and efficiencies related to quality that can benefit both cost and benefit quality in the end. And so I think if you do it the right way, it's really important. As many of you know, I think major institutional for-profit conversions is not the right way to go. I think there's a lot of room for for-profit medicine. I don't think it belongs in the inpatient acute care setting. But we've seen some, I think, important consolidations in the nonprofit world happen that are beneficial to the state, and some pending consolidations that both Senator Blumenthal and I have some questions about on the payer side as well. So the federal government's got to sort of be awake to that reality and be flexible to understand how these new consolidations will affect states like Connecticut. But that's the world we're living in. If we do it right, I think it could be good for both investors, patients, and practitioners.
You may want to need that one. You and I go back and forth with that. We can both sing a tune later on.
Okay. Well, let me begin just as a kind of human reflection on this NIH budget. One of the most powerful revelations to me was a lunch where I listened to Dr. Collins, who's the head of NIH, talk about what we were sacrificing in the way of research as a result of the arbitrary slashing cuts in his budget at NIH. The term sequester is not exactly a household word in Connecticut or around the country, but sequester, you'll recall, was the policy of making cuts across the board in both defense and non-defense programs, a policy that was so abhorrent that it was actually supposed to incentivize a budget agreement. When the budget agreement wasn't reached, sequester went into effect, which resulted in very severe cuts across the board to NIH and, by the way, to our defense budget. And one of the accomplishments that we did in the Armed Services Committee was to segregate out the submarine program and to continue this building of 2 subs a year to make sure that we continue to build the F-35 despite doubts about it, and the helicopter programs, all of them very, very important to Connecticut. And I was very proud to fight for them, not just because they benefit Connecticut, but they're vital to our national security. And that program was in peril because of sequester. So was the NIH budget. And what I heard from the NIH director was cancer research, other kinds of vital life-saving research that was being delayed or defunded or applications denied because of sequester. So this is a really important step for healthcare in America, but also for job creation and for economic growth, because we know in Connecticut, because of the biotech revolution or evolution progress here, that we can be a center of this kind of research and development. I think, I'll just be very blunt, the mergers that have been proposed among insurers raise very, very serious questions. They raise serious antitrust questions. I've said publicly that I just don't think they'll pass muster. I've called for an investigation by the Department of Justice. The Department of Justice has agreed to do it, and it has agreed, equally important, to do it in the way that I suggested and urged, that it look at the whole industry, not merger by merger, but the entire industry, because I think that there are impacts on the fairness and competitiveness that can ripple down through the process for reasons that Senator Murphy described. And the impacts are not only on the industry, they're on us here in Connecticut because of the impact on jobs. And I am very, very concerned about those impacts. It's not a matter of strict antitrust principle or legal doctrine, but it is a vital concern that I have, and I've expressed it in the Judiciary Committee's antitrust subcommittee hearings. I'm on that subcommittee. We're looking at a bunch of other mergers as well, where I think competitiveness may be at stake and consumers may be impacted. And by the way, other businesses may be impacted. And competition is vital to consumers and a level playing field for businesses so they can offer consumers the best possible products at the best possible prices.
Let me just mention two other quick pieces here,
Sure.
just for folks to know about. The end of the year budget deal involved two major changes to the Affordable Care Act that folks should know about. One, they are both a postponement of the Cadillac tax, which was going to hit a lot of employers, a lot of small towns, a lot of boards of education hard. So we get a period of relief that many believe will be permanent. And then a similar abeyance of the tax on medical devices. We've got some big medical device companies here in Connecticut. Matters a lot to them. The second thing is just, as we look at prospective healthcare policy, one of the best chances for bipartisan legislation this year, 2016, is in the area of mental health. As many of you know, I've written the leading mental health reform bill in the Senate, 8 Republican co-sponsors, 8 Democratic co-sponsors. Senator Blumenthal has been very active in this space as well. There is a chance that we get a major reform of our mental health system this year coming out of our committee, the Health and Education Committee. Hard to get anything done in an election year, but this is one of those areas in which the two parties do agree on that we've got a bipartisan bill, a major big bipartisan bill that can be the foundation. And that would be great news for us here in Connecticut because, providers are struggling to keep their heads above water in part because of some really draconian reimbursement when it comes to mental health services from the federal government.
If I could put a plug in, is this one working? There we go. All right. we're specializing in AV technology today. That's our new.
I'm assuming nobody's heard what I've said.
It's recorded, though, Senator. One thing I'd put a plug in for to both you and is the focus we've had on the health sector as an employment growth. Our Connecticut Health Council has been working with many people in this room to drive more collaboration across all these sectors, providers, payers, researchers, capital, because we do believe that we've got a very unique combination of assets in this state that properly working properly together can be more fully leveraged.